Good day, I'm Theodore Henry, and this is your JIS News for Friday, December 9, 2022. Prime Minister Andrew Holness has alerted that Jamaica intends to capitalize on its crime-fighting relationship with the United States to go after Jamaican immigrants in that country who are influencing, soliciting, and funding crime on the island.
And we have a list of them that we intend to pass on to you. But we would welcome your help and support in identifying, tracking, and prosecuting those persons and potentially extraditing them back to Jamaica.
Mr. Holness has also asked that Jamaican traffickers and guns destined for the island be given priority attention under the new Bipartisan Safer Communities Act passed in the United States in June of this year. The Bipartisan Safer Communities Act creates a legal framework to interdict and prosecute persons illegally exporting guns from the United States. The Prime Minister was speaking with senior officials of the United States Justice Department this week during a high-level meeting of law enforcement and security agencies. He was accompanied by Commissioner of Police Major General Anthony Anderson. The meeting was being held in the United States to discuss the growing threat of transnational criminal gangs, organized criminal violence, and the trafficking of illegal guns into Jamaica. It ended with a commitment for greater and more effective information sharing. Opportunities for further expansion of institutional and human resource capacity building and training were also explored. The United States senior security officers expressed confidence in the efforts of the Jamaican government and expressed their own commitment to greater crime-fighting collaboration with the island. In other news, the Beckford Lodge Road in Westmoreland will be rehabilitated at a cost of $41.7 million. On Wednesday, Minister of Local Government and Rural Development Desmond McKenzie signed a contract with Wadmar Construction Limited to execute the project. The contract is being financed from the Equalization Fund and will be implemented and supervised by the Ministry and the Westmoreland Municipal Corporation. Work on the approximately 1.9-kilometer roadway will be done over 4 months from January to April 2023. In addition to resurfacing the road, draining features, including curbs and channels, have been incorporated in the design.
All the materials that will be used on the road will be subjected to testing and can only come from the approved source, Mr. Contractor. It can only come from where we recognize as a source that provides quality material.
Minister McKenzie says an annual maintenance program will be put in place to preserve the integrity of the road. Patients at the Kingston Public and Notta Bay hospitals who require respiratory support can expect better oxygen assistance. This is thanks to a $2 million project that will install piping infrastructure to deliver life-saving oxygen to the bedsides of patients in need of respiratory support. The Liquid Medical Oxygen LOX project was launched yesterday. It is being funded by the United States Agency for International Development, USAID, and implemented by meeting targets and maintaining epidemic control, EPC.
This $2 million expenditure in what is, as we have said, a life-saving venture will only enhance the relationship. My fundamental takeaway from this is that COVID, in a very strange way, has brought us significant opportunities to enhance both friendship as well as enhance our public health infrastructure.
As part of the project, hospital staff will be trained to ensure the efficient management, maintenance, and sustainability of the country's liquid oxygen ecosystem. Senior Program Officer for EPC, Sue Ann Wallace-Brown, emphasizes that the true beneficiaries of the initiative are the thousands of Jamaicans who will access care at these facilities.
We're pleased to be partnering with the Ministry of Health on this LOX project. We call it LOX for short, Liquid Medical Oxygen, because it is not just for Jamaica, it is for Jamaicans.
Meanwhile, healthcare facilities across the island are to benefit from the donation of medical equipment and supplies valued at approximately $1 million. The gift, which was facilitated through the Ministry of Foreign Affairs, was handed over to the Ministry of Health by the Government of the Republic of Korea on Tuesday. It includes bedside stethoscopes, operating theater tables, anesthetic machines, electrosurgical units, diathermy pencils, and incubators. State Minister for Health Juliet Cuthbert-Flynn says the medical supplies will support critical areas such as maternal care for babies and surgical operations.
We continue working fervently towards equipping our facilities to respond to health emergencies and complications that they are likely to bring about. We are certain that this donation will further assist improving the quality care offered at public health facilities, particularly in special care nurseries and our operating rooms, to improve the health outcomes of those who, for one reason or another, may find themselves there.
The donation builds on Korea's steady and consistent support to Jamaica since the start of the COVID-19 pandemic in 2020, reflecting over $2 billion in supplies to date.
My government looks forward to the continued strengthening of our bond as bilateral partners and friends.
And finally, over 4,000 healthcare workers have so far received customer service training as part of the Ministry of Health's Compassionate Care program. Portfolio Minister Dr. Christopher Tufton says 15 hospital waiting areas have also been renovated under the initiative. The Compassionate Care program began in 2018 to focus on the improvement of service delivery and care in public hospitals and health centers. Minister Tufton provided the update on Tuesday at the reopening of the new Chapelton Hospital in Clarendon. He also used the function to reveal that more would be done at the community level to get persons to take preventative action on their health.
Chapelton represents a community health system that I hope will be taken advantage of. But we're going to roll out more in the new year, some mobile health systems where we go into communities and we encourage and incentivize persons to come out and do their health checks.
And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.